Sweden's health watchdog says it has uncovered serious shortcomings in protecting the country's care home residents during the pandemic. The Health and Social Care Inspectorate spent months investigating nursing homes after complaints from relatives and staff. The watchdog said there wasn't a single region in the whole country that had taken sufficient responsibility during the pandemic, adding that a fifth of patients received no individual assessment from a doctor. Our reporter Per Bergfors-Nyberg has been following the story from Stockholm, where we can cross live to now. Good evening to you, Per. The investigations found serious shortcomings in the care of the elderly. Just give us a few of the examples that were unearthed.
Well, good evening, Ollie. Basically, what this is all about is that these elderly people living in care homes, they just didn't get the same chance as meeting a doctor like everyone else did in our society. What this report states is that only about 20%, 20% actually didn't meet a doctor, and only 7% actually met a doctor in person when it came to getting an individual assessment. Instead, they just gave everyone pretty much the same treatment. There were also serious shortcomings in terms of the patient journals. They didn't inform the patients and the family members about what care they were going to give when they were suspecting or had COVID-19 confirmed. And there was also really sharp criticism when it came to palliative care, giving care in life's final moments. Sometimes they hadn't even confirmed that it was COVID-19. These patients, they didn't even get to see a doctor before getting medicines such as morphine. And over these last couple of months, I've heard so many stories like this, and one of the ones that I remember is Juliana Gihem. I met her back in May, and she lost her uncle Moses.
Never got the chance to meet the doctor, and the doctor responsible of him said that he never met him, so all the decisions were made by telephone and not in person, so he couldn't see him and see the state that he was in. But on phone, the nurse said that, well, he's weak and he's got high fever, but we're taking care of him as well as we can. And we were wondering, but why can't he get that hospital care he needs? And they said that they were just following the orders that they get from the higher people.
So Juliana Gihem, she called the care home and she begged them, please take Moses and Tanda to hospital. They refused, saying, no, this is just not the way we're doing it here. We're going to treat him here at the care home. A few days later, he died, but he was all alone, so they don't even know what time of the day that he died, Ollie.
And Per, cases are shooting up once again inside care homes. Is there a fear that history is going to repeat itself in Sweden?
Absolutely. We used to have a national ban on visiting care homes that was removed on the 1st of October. Then last week, the government announced that they've now given permission to the Public Health Agency to issue local bans on visiting care homes. And now we're seeing hundreds of new cases shooting up all across the country. So we're going to go back into this situation of family members not being able to visit their loved ones. And still, though, the regions, they haven't figured out the way they're going to care for these older people. That's what this report also stated today, that now the regions, they need to get back to them within a couple of months to explain what they're going to do to sort the situation out, because the way things are going right now, it's just not acceptable to this report, not even during a pandemic, Ollie.
Thanks, Per. Per Bergfors-Nyberg joining us there from the Swedish capital.